and welcome to today's Rise to Immunize campaign interview. Today, we'll be hearing from Dr. Anna Nobis, Medical Director, and Qian, Clinic Manager of Vanderbilt Occupational Health. They'll be sharing more about Vanderbilt's Flulapalooza event. Thank you both for joining us today. Now, I understand that Flulapalooza was created as a way to test Vanderbilt's emergency mass vaccination capabilities. And as a bonus, you were hoping to break the Guinness Book of World Records for most vaccines given in 8 hours, which was previously set by Kaiser Permanente. Can you share more about how the first Flulapalooza event went?
So for that particular first event, we designed a vaccination clinic in the tent centrally located on campus with 44 vaccination stations working simultaneously. Okay, so on the day of the event, I still remembered on October the 12th and 2011 at 7 o'clock, we opened our events to a long line of the excited Vanderbilt faculty, staff, and students. So after 8 hours, we had given staggering 12,850 vaccines. Okay, 12,850 shots. So we made a new Guinness World Records. Okay, so on that day, to accommodate the staff working late, so we continue keep the events open for 3 more hours. Then at the end of the day, we give 14,000 shots. Okay, so I still remember the moment all the participant events, stakeholders, event planning officers, and everyone was so excited when we made an announcement how many shots we given.
That is a lot of vaccines that you were able to provide.
Yes, everybody's so excited. We were so proud of what we did. It was an amazing event anyway.
It sounds like you were able to engage the community in getting their flu shots by promoting this event as an opportunity to set a new world record.
Yes. So Kaiser gave us 6,215, but we made a 14,000. See the big difference in it.
And then given the scale of this event, talk about the different stakeholders that you engage.
Yeah, I'm happy to take that question, Morgan. So first and foremost, we had to have the support and engagement of our senior leadership team, which we did, and that greatly paved the way. So with that support in hand, occupational health then took the reins and we coordinated the event with many partners. So I'm going to list them all out. It's quite a list, but emergency preparedness, student health, pharmacy, supply chain, environmental services, plant operations, definitely want to work with marketing and IT, security, traffic and parking, paramedic services, make sure you have your paramedics on board, and then our nurses and pharmacists volunteered to give the vaccines, actually.
That is a long list.
Yeah.
Awesome. And then you've been hosting Flulapalooza since 2011. How has the event evolved over the years?
Yeah, so as Catherine mentioned, it was actually envisioned as a one-time experiment, but it went so well that really there was no going back to business as usual. So some things have changed while others have stayed the same. So the event planning committee uses continuous quality improvement to see if we need changes in our layout, in our supplies, in our staffing, and in our documentation process. So everybody looks at that and sees, okay, where can we improve the efficiency? So one example that I can offer of how things have evolved, again, using that continuous quality improvement, is that we are able now to administer the same amount of vaccines with 18 vaccine stations instead of the original 44. So that's a big efficiency improvement. But otherwise the name has stayed the same. It's a catchy name. We're proud of it. And we offer stickers every year that become very coveted items, very colorful, and so that's a big thing that has stayed the same.
What are some tips you all would give to another medical group planning on implementing a mass vaccine event?
Yeah, I'll take that one. So basically, here's the recipe, okay, that we have followed. You need to obtain support, again, from institutional leadership, as I mentioned earlier. That's very, very important. Got to have them in your corner. You have to have a planning team that involves all the necessary stakeholders. And then you have to have a leader of that team, someone who can maintain the momentum from one meeting to the next, keep the group organized and on track. Has to be someone that's very dedicated because there's a lot of moving pieces and a lot of details to account for. And then when you have those meetings and all those stakeholders I mentioned earlier, they need to be included on those meetings. They can't just be brought in at the end. And they need to have a say during the planning process and be given an opportunity for questions and concerns. And then that same team has to all be on the same page. And so that's why it's very important to have protocols and policies written out so that everyone, again, is on the same page, all talking the same language on the day of the event. And then, of course, just a very efficient marketing team to help get the word out. We all have so much information coming at us all the time that we have to be able to kind of break through that. This is a one-day event, so we really want, for the amount of effort, time, cost, et cetera, that goes into it, we need to really have as many people as possible participate. And, it's been very, very successful for many years now, over a decade. And it's affectionately known as Vanderbilt's Family Reunion because you'll run into people that you may not have seen for the past year. And then everybody's there, getting their flu shot. And it literally takes people probably less than 5 minutes. So that's the recipe that we follow.
Awesome. Wonderful. Well, thank you so much. I really appreciate you taking the time to be here with us today and share these great insights for improving immunization rates.
Thank you so much for having us.
Thank you, Megan.